Welcome everyone, and thank you so much for joining today's webinar. Let's chat Promoting Interoperability, a success story.
Thank you so much, Bree, for that introduction. Good afternoon, everyone. My name is Selena Williams. I am the program manager for the Medicaid Promoting Interoperability Program. Today, we're going to share with you Hybrid Solutions had the opportunity, and when I say it was a great opportunity, it was an awesome opportunity to chat with Mr. Kenneth Rice, the Office Administrator for Amazing Pediatrics. So let's chat Promoting Interoperability, his success story. As we share this, he's going to speak on some of the best practices, what he did through his 6 years of successfully promoting interoperability. He's completed 6 years of the program. He's going to share some best practices and his experiences throughout the program. Thank you.
Good afternoon. Thank you, Mr. Kenneth Rice, for joining us. We have Mr. Kenneth Rice from Amazing Pediatrics, and we're just going to give him a brief interview throughout the 6 years of his success through the Promoting Interoperability Program. So I'm going to start off with a few questions, and I'm going to pass it to Liz, and this is going to be very interesting. So, Mr. Rice, could you share with us a little of your background with the healthcare setting?
Well, we basically, I've been married about 26 years, and my wife kind of imported me into the medical field in 2002. We were doing a public health assignment in North Carolina, and it just turned out that they needed some expertise from an engineering standpoint and also from a business standpoint. And also I was free. And so you couldn't beat that. They were basically paying my wife's salary. So they got, basically 2 for 1 in terms of their clinic.
Oh, wow. Thank you for sharing. Liz, do you have any feedback on that or any questions for Mr. Rice?
No, I think the next thing that we wanted to ask him about, I'm sorry, I had to laugh. I know that messed up our audio a little, but that was just kind of funny. We're considered free too, so we totally understand that. So I think our next question that we wanted to ask was how it evolved into you taking over the meaningful use or the interoperability piece. Were they already doing that, the practice already doing that, or did you start it from scratch, or how did that happen?
How we started was my wife decided we were going to open up a medical practice, okay? And that was about 10 years ago because we had seen different models in terms of rural America, larger HMO organizations, and I told her I think we can do a pretty good job ourselves. And so we proceeded to basically get different equipment, and we had an equipment list and certain cost factors associated with starting our practice. And we got to the point where it was opening day, and we had to pay for the electronic medical records in advance. And we kind of used, as everyone does in the medical field, our last dollar to pay a credit card payment for electronic medical records. And you basically got a shell, and you had to introduce your billing and different things. And so as she, in normal fashion, she said, okay, I love you, tag, you're it. Okay, you're the czar for, for meaningful use. And so I was already working with the vendor at that particular time, and they gave me a little bit of information, and I just, started having my one-on-one sessions, and then I would give the condensed version to Dr. Rice, and then we just, we started to proceed. And I said, all these demographic information, every area that has a yellow in there, a staff, we've got to put that information in there, and also that includes you, Dr. Rice. So it made for interesting bedside conversation.
I'll bet it did. So you mentioned putting the demographic information. I guess I was thinking that you started after stage 1 was over, but if it was the demographic information, did you start at the beginning with stage 1?
Oh yeah, we started from, you're giving us credit. We started at the implementation phase in terms of actually getting the software and loading it on to the different systems and making sure that your server worked really well. with your actual desktop computers and your laptop computers. And then it was like, tag, you're the IT person for all this implementation.
Well, then
And so I ended up being the IT person to get everything up and running, to basically see the patients on day one, and the procurement of the hardware associated with that.
Oh my goodness. I hope you're still not free, but I'm just saying, I do have to ask though, you've participated in the Medicaid Promoting Interoperability Incentive Program or Meaningful Use Program or whatever for all these years. What do you think? Well, as far as the practice is concerned, did it impact you? Did it change over the years how you managed it? Or could you share that a little bit, how it changed over the years and how it changed for you in the practice?
For us, I think the first hurdle was, the implementation phase, and that took a lot to get your system up and running. And then once you got to, stage one, that's where kind of from a quality standpoint, whether it's healthcare or engineering or any application that you got, that's when the metrics started to come in. And then, there was like different roadmaps and different training sessions that people gave you. But it's one thing to have a training session. It's another thing to actually get that information off whatever EMR system you're using, and then making sure that it's alignment to get, meet the roadmap success for stage one. But stage two was basically a bootstrap camp. I said, this is all good. Everyone give each other a pat on the back. The stage two, we're linking up with the Georgia registry, and we have to show proof of the implementation of the Georgia registry, the notes and everything. We've got to close these charts out in less than 48 hours. We've gotten pretty proficient at, 24 hours to get to the stage three component, because as you went up each stage, you needed more real-time data. And so that required a lot of early mornings, running the numbers. And I worked with Ms. Williams extensively the last 2 years. During this process, we started with one EMR vendor, then we got a notice, and it was like, oh yeah, in 45 days, we're no longer going to be in business. And so we had to switch everything, the whole system that we actually had developed, and switch it over to basically a different vendor. And people said, oh, you got 4 months or 6 months. I said, no, we're going to pull the plug. The best time to do this is like right at Christmas. We got 2 weeks of downtime. So we literally in 30 days went from one old EMR system to a new EMR system. And then we had our front office staff loaded in all the demographic information. And then by that point with the old EMR vendor, we were like at stage two, but it took us 9 years, because once you switch systems, you're just trying to kind of fight for survival for your business, make sure that you got all your patients loaded up. And it was like a whole nother year with the new vendor to set everything up and to make sure that you're at the right stage. And they were like, oh, you're at implementation, or you're at stage one. I was like, no, we're at stage three, but we just switched over to you at stage three. So that took a year. And of course, another bedside conversation is like, well, you're not done with that yet? In terms of running all the data for stage three with a new EMR vendor.
Kind of like some of us getting through college. I'm just saying. Yeah. Selena, I think I'm hogging all the questions. I think you had a question you wanted to add.
Yeah, it kind of leads into your next one after I asked this question. He kind of answered my next question. Actually, he talked about, and by the way, Liz, those were some interesting questions. Mr. Rice, and you really elaborated on those. So I was going to ask you, what were some of your greatest challenges? I know you talked about from the beginning, the implementation, and then you talked about moving through the different stages, and also switching each EHRs during that process. And so, hey, that kind of leads into our next question, what Liz had regarding vendors. If you can kind of share with us the different vendors you used throughout the process of your 6 years.
Well, and if I could,
we started out with soap.
Kind of sprung that one on you, and I'm sorry we didn't.
No, it's not a problem. We started out with soapware, and I remember the monthly payments associated with soapware. And with me being in engineering, it kind of looked like Fortran 77 or Cobalt code to make everything work. But once you start making it work, you understood what it said and what the Excel spreadsheet said, you're like, okay, we can kind of make this successful. And so the whole staff and resources, we kind of got them used to, this is the report, this is what it is saying. You got used to working with your vendors in West Virginia that may have been supporting the system. It wasn't a such thing as, well, it's all local. I mean, you were talking to people, across the country to hit the different objectives. And so I think as a grown man, it was about ready to cry when we had to switch over because I said, I learned all this stuff. We got to learn this all over again. Not only that, but the staff has got to be able to put all the information in there. And then we went from like Fortran 77 or Cobalt or, like a low version of Windows kind of sort of, but it worked, what I'm saying? It was certified to like, we got this nice Cadillac package, which was a thing. And it just had all the bells and the whistles and it just looked fabulous, but you had to learn how to drive that new vehicle. And so it just something as simple as, you talk to us, you interface and you say, this is how it physically needs to be set up, even for you to just get your dashboard. And so then, there was one year I was really close and it's like, oh, you have to work next year because you're beyond your 90-day period to run this data. And so it was hurting my head because I think I had worked with the team and put in different case studies multiple times. And then my Dr. Rice said, you're not done yet. And so, but it was comical. You have to have a lot of comedy so not to cry, and so as we went into Athena and we got everything working, it was time to shoot up the flare or the SOS. And then I reached out to Georgia High Tech and I said, okay, I know what the old Medicaid PI system is. We're moving on to PI, and I understand everything's changed, but we need some help. What I'm saying? I said, we know what the buckets are. We know what the CMS requirements are. That changed because it used to be like you had to have tooth decay in there. There were certain things that you had to have. I still remember those things. Dr. Rice still remembers those things. But it swapped out a little bit and they gave you more flexibility because the old template, it was like pediatrics, you had to do these things to be successful or else, kind of game over. So you learn how to do that. You learn how not to ask a whole bunch of questions. Then you get this nice system and it's like, well, we'll give you kind of whatever flavor you'd like to have, but you got to choose that flavor in these buckets. So of course, again, it was the running joke is you're not done with that yet, and so we got to a certain point and then we start having those intense conversations with our current vendor and basically saying, okay, this is what I'm seeing. I think that if you did a beta test or alpha test, this is the glitch in your program. Most people would say, well, how do you have confidence in that? I look at enough data with a certain confidence level that I could tell the vendor, I'd say, well, this is what I see, and these are the patients that should be incorporated into the module. Can you have your team that developed the program kind of look at that? Then it got to a certain point where people would kind of say, well, Mr. Rice, you're right. There was a case that was created and that was 2 weeks ago. Well, you didn't tell everybody that, but we worked through those things. And then from a resource standpoint, you can imagine you'd like to keep the same staff for over a 10-year time frame. But in the reality of the world, people, basically change jobs every 3 years. So one of the opportunities we had was just training new people on this, why this is significant. By the time you look at 10 years ago versus now with the portals, the patients are like, what do you mean my drugs are not at the pharmacy? Because now your EMR system is the formulary is instantaneous. We have to tell patients it's coming. It really will be there within an hour, because they don't understand the background work where it has to go to a server and then get pushed down to all the Walmarts and the Walgreens of the world. But I think it's changed our quality of life because you can kind of do some things remotely if it's critical, And so I think that it's made everyone's life better, but a little bit more complex at the same time. You got the daily records and the daily checks, but us as providers, we can go back 10 years and basically we still print out a daily check sheet of who we saw, because if you get audit from an insurance standpoint, it's great. But if you switch over different, platforms or EMRs, that paper copy is your saving grace.
Wow, thank you so much. You have provided us such great information, and I hope the providers are really listening. I'm going to go on to the next question. So what is your biggest lesson learned? Can you share that with us, please?
I think my biggest lesson learned for our group, for our practice, is that, okay, it doesn't matter if you have 3 degrees, okay, engineering and MBA. It doesn't matter if your spouse is an MD. That throw all that out the window. It is about survival. And for you to survive, there are subject matter experts like yourself. There are people in West Virginia to this day that are part of my LinkedIn process that help me when we talk about like each other's children getting older and grandchildren and all those great things, and where the children at in terms of college or high school. But it's touching base with people who are subject matter experts that give you the knowledge, because all the degrees you have are not going to help you accomplish this assignment, right. Because like sometimes it's just as simple as you have got so many computations or numbers that you have to crunch. The Cadillac program did print everything out, but how you got it out, it listed 3 different insurances for one patient. And then if you're looking at 500 patients, you got to basically cut that down into a version that it is concise, that you can pass an audit. And we've been audited before. But one of the nice things was once we got audited, we, as a pediatrician, you could get paid out at a 20% level or 30% level. Well, we kept all our claims and everything from, when we did the implementation phase. And I said, the only thing that was better for me is that, I quite thought we was at 30%. And they came back and did the audit. And they said, even though you didn't get paid for it, major pediatrics didn't get paid for it, you get credit. So it was like 4 years later that we got the money for the 30% payout. But it was only because we kept detailed records. Pay attention, everybody. Detailed records, because sooner or later you may get audited. And when you get audited, it's not like someone's, coming out and saying, oh, we got you. It's just to make sure that, everything is sustained. And please respond to the email. Take a second.
Yes.
Take a second and breathe, but please respond to the email. And if you need more time, they will work with you. And it was a great experience for me, because at the end there was additional financial component associated with that. So I think it's, but could I have done all those things by myself? Absolutely not. It's using your network and your resources and the things that are available, and just don't worry about how many, how smart you think you are. You're not going to be as smart as the team of individuals working together as a unite, from a unity standpoint, to get you to the finish line.
Well, thank you. And thank you for including us in on that team. I know Selena did tried to work real good with you in the last couple of years. So we appreciate that. Now, we talked a little bit about the meaningful use to promoting interoperability transition. Was there anything part of that transition that was harder than other pieces, or that surprised you with the difficulty, or was super easy? How about that transition from?
I think that everything, when you first see something, it's like coding or something like that, or everything when you first see it, it is surprising. Okay? Because you're trying to wrap your head around what it is that everybody wants for you to be successful beyond just a dashboard standpoint. I think the hardest part was communicating to people that, you're doing your best, and I appreciate the best that you're doing, but for us to hit this measure, we have to do the workflow a different way. I think people get used to doing things a certain way and they're comfortable with that. But to make sure that your EMR program works effectively for you to actually get credit for it, you needed to make sure that you had the right workflow. And having worked with 2 different systems, a lot of times you could do things, but you have to make sure that your workflow is tracking the metric. And just having people be receptive of, I'm not criticizing you. This is what needs to get done for us to be successful as a practice. That's the hardest part. Yeah, for me, the people person part of it. And also, if you've been married for 26 years, explaining to your spouse, we need to redo a workflow.
from that engineer perspective, it's always the people part that's hard. Has your approach changed any? Do you find that if you get a new employee, it's best to train them real hard on which boxes to check up front, or is it best just to throw? Has your approach changed any?
Well, what we did as we went through different EMR programs, what we try to do is like create workflow templates to help the new employees. And so on the front desk part, I would work with the person one-on-one and say why it's important to actually fill out certain components. On the backside part, Dr. Rice, she kind of always would help out with the provider portion and the immunization piece, and then I would help audit that particular component. But when new employees come in, we start with that kind of sit down at the computer and we just have them enter the demographics and make sure that they can understand what needs to physically be in the system. Not only just from Medicaid PI standpoint or PI, it's just to get reimbursement for funds nowadays, because everything's now, relative value units is attached together. So what you want to make sure that you get all the information up front, that they can have access to the portal. It's multifactorial, but for me, the most important thing is just when they hit the door, I know that you were great where you were, but this is how we have to do it here. And we don't have, 10 people, it's a limited staff. We're using an EMR system. This is how we do it for us to be successful. And we want you to be a part of our family and stay forever like us. But we understand that sometimes people, they grow and they move out.
Thank you so much. And we're almost to the end. Again, I appreciate your time. And of course, we can't end this interview with asking a question, considering the last year, the challenges we've been through and these unprecedented times that we've been going through. Just want to kind of ask you, how has COVID-19 and the pandemic impacted your practice and your efforts to promote interoperability successfully?
I think the biggest surprise is when the economy started shutting down last year. And there was such information out there that I think some people were just afraid to just come out the house and even see the doctor. So I think that every provider in the United States saw that. I mean, there's some specialties that they couldn't see, like elective surgeries, they cut that out. If you were working on, in terms of Medicaid, or PI from that standpoint. So it went 100% telemedicine. We have friends who were in the psychiatry field and telemedicine, that boomed for them. But for us, you have to see the child, to kind of do the diagnosis part. So we stayed open the entire time frame. But a lot of energy that we would use for, PI, we had to use that to okay, how do we change up our workflow? Very few people in the lobby, and then more people in our 3 to 5 exam rooms, and then kind of telling patients when you can come in, when you can go out. And we still practice that even till today, because unfortunately it's not over. We're still living with this component. So your numbers decrease, and you have less patients. So it becomes even more critical that you're entering the data for each one of the metrics correctly, because if you don't do that, you got less patients to make up for any adjustments or changes. And so as people go to to the last year 6, last 2 months, just make sure that your staff, that you're training them the best that you can. Number 2, don't give up. If you listen to my story or our story as a practice, it's about faith and just pure determination. Just one way or another, we're gonna get this done. And even myself, there were points where I was like, okay, well, I got the one EMR, it was year 2, and I thought, well, maybe that's all the money we're gonna get. But luckily, I had a supportive spouse who said, no, that's not it. We still got stage 3, still got 2 more years, and then just working with really good people. But I would just say, just don't give up. Use your resources. Okay, they're out there. Whatever issue you're having, your EMR vendor may know about it. You may just not know about it. And then if there's a workflow problem, talk to your vendor, see how you can improve it. Remember, if you got 2 months left and you're only using a third of the data, you can get 2/3 fresh data, and maybe you'll hit that measurement. So just reach out to your team, reach out to your vendor, and even though it may drive you crazy, that my guidance counselor say the tassel is worth the hassle. So if you do these things, you will get compensated in the end. But most importantly, it'll help your patients, and they can see where you're at, because a lot of practices are under a lot of strain with all these different safety measures that we're putting in. It's nice for the patient to go out to the portal and they can look at a history, and then they can send a message to you, and then you can respond back. It's nice to be at this part of the equation and everything's working. That's a blessing.
Yeah, so that was my last question. I was going to ask advice that you would like to give to the practices on the ones that are going to be attesting. This is the final year. The program ends September 30th. So we have a lot of providers that are out there that haven't attested. You have already successfully attested for your 6 years, and received payment. So that is awesome. Liz was able to assist you with that. That's amazing. So I guess you gave some good advice on how they can be successful these last 2 years. Any other thing you want to add before we end this interview? It's been awesome.
To me, it's been a journey. Okay, for our practice, for our family, it's been a journey. And I know for some people it's frustrating. It's like, this is just another thing I've got to do.
Right.
If you look back at where you started, you have to know that your practice is stronger because of this.
Absolutely.
Liz, is there anything else that you'd like to add?
No, I'm just delighted. I wish we'd put together about 5 more questions. I could talk with him, listen to this for a couple of hours.
I know he's awesome. When you first came, I think I met you program year 2019.
Yeah.
When I first started working with him, and I would call Liz because some of the challenges we were facing with Athena and some of the documents that couldn't be generated, we were calling, and I think we got down to the end of almost to the deadline to submit for that program year. And I was like, what are we going to do? And he was like, I have this documented, I have this saved in the folder. He was just so meticulous about having everything documented in case he was audited. And I think that's very important. I'm so glad that you gave that as one of the best practices, to make sure you have your documentation in case you're audited, because he had everything in order and on point. Well, that's what you need, because you never know when they're going to come back and ask for that documentation.
To his point, don't give up. You only got a couple months left here, guys.
Yeah.
Be tenacious. Stay on those vendors if that's what you need to do. Call one of us. Heck, if we need to, we'll call him.
Right. And sometimes that happens.
I think I did ask you about the clinical quality measure when a provider was facing they couldn't, or was it you?
Yeah, it was me.
Yeah. You could only generate a year, and I think
1 year. There was a customer report you had to generate. But most importantly, too, I'd say I've got a great, wonderful, loving spouse. And if there's any disclaimer of anything I've said, you know me, I apologize in advance.
Yes.
That was great. Great.
Yes, this has been awesome, Liz. Thank you so much for joining us. And Mr. Rice, I can't thank you enough for doing this interview. Congratulations, you're done. But it doesn't end here. And I'm going to ask you one more question. This is really my last question.
Okay.
So I know we've talked during our times of working together, and we've talked about the HIE piece. I know even though the program is ending, providers are still encouraged to promote interoperability for quality of care for their patients. So would you be interested in maybe, I know we met with Rudy and kind of went over that regarding our HIE piece. Is that something you think you would be interested in, to exchange data with other providers?
Yes, I think it's always good to get to that level. Right now, I think a lot of providers, in terms of programs, the cash flow is not as good as what it used to be. But I think as our cash flows improve, I think that there'll be more rollouts, and I think it'll be easier to implement certain things. But I think a lot of people now are still treading water, in terms of like a decent sized practice or mid-sized practice, even bigger hospitals, they're having to make some critical decisions on their end. But I think as the economy improves, then I think that there'll be more resources out there from an exchange standpoint. I don't think it's that people don't want to do it. It's just financially they're trying to figure out how to keep everything running and afloat, and because there's some parts with the, I don't want to get into the Delta variant and all those different things, but it's just like you get to a certain point and you think, oh, it's ending, and then it's like, oh, it's back again.
Yes.
And it's just like, oh my goodness. And so everyone is basically like all the measures that we did before and vaccinations with staffing and all that. How do we make sure that we don't hit a bump in the road? And so you're probably having to keep more of a cushion than what you normally would have in the past.
Yeah, it's a challenge, especially for small practices.
Mm-hmm.
So that's definitely understandable. Well, we're going to end at that. Thank you so much again.
Okay.
Have a great day.
And everybody keep on going.
Keep going.
You can do
Call
it.
us. Call us. We're here to help.
Thank you.
Hybrid Solutions has an amazing partnership with Formed Approved. Formed Approved is a discounted training, continuing education, and professional development opportunity. It's accredited, it's self-paced, and it's an awesome resource to get some of those CME credits or CE credits. Please use the coupon HighBridge20 to receive a 20% discount. Again, please use the coupon HighBridge20 to receive a 20% discount. The website is www.formedtrainingcenter.com/hybrid solutions. Again, that's www.formedtrainingcenter.com/hybrid solutions. Please make sure you head to our landing page and utilize this awesome resource. You will not regret it. And finally, feel free to contact us or contact Selena, our program manager here at HighBridge. Again, HighBridge Solutions hosts these webinars every third Tuesday of each month from 12 p.m. to 1 p.m. So we're always grateful when you all stop by. Again, thank you so very much. And I want everyone to have a wonderful afternoon. Bye-bye.